Themba, who is the Executive Director of Right to Care, and Stephen Brado, who is the Chief Executive of Liberty Retail. But joining us now is the one and only Dr. Ali Bacher. Now, Dr. Ali Bacher, believe it or not, is actually the chairman when it comes to the Right to Care board. So it's so nice to have you, and welcome to Morning Live.
Thank you. I've been chairman since 2008. I'm very proud to be associated with this NGO. They do fantastic work. We got a energetic, enthusiastic, committed executive, a board of directors of 11, mainly independent directors, and the whole organisation is just committed and full of enthusiasm, doing wonderful work. At the clinic here, we have the biggest number of patients around the country treated, about 15,000. We probably test about over 300,000 people a year, 140,000 treatment. So they're really doing fantastic work. And I see the Minister of Health has just arrived, and really he's been a breath of fresh air to healthcare in this country. And we in Right to Care want to congratulate him and ask him to continue the wonderful work that he's doing for healthcare in this country.
He certainly is, and he is here, as you said, and we'll be chatting to him in just a few minutes' time, so stay tuned for that. Now, here's this check you were talking to me about, Stephen, 250,000 Rand that you are giving to Right to Care Health Services. I see a big smile on your face over there. Again, what are you hoping this money is going to be particularly aimed towards? I know we briefly spoke about it, but just remind us again.
Right to Care does some amazing work in terms of innovation and utilizing technology to make a big difference to all the people of our country, the people of Gauteng, in terms of all the testing and treatment post the testing for HIV, TB, and the check is going to form part of a project in terms of automating the pharmacy dispensing and medicine control here at the clinic.
Fantastic. Now, I mean, you know, there's great ideas and there's so much you want to do, but without the money, you're not able to do it. So something like this, where corporates get involved, I mean, this alleviates the situation for you a lot.
It makes a huge difference because I think, as our Honourable Minister has said as well, the government can't do healthcare on its own. We need the partnerships, we need the support. So we are grateful to Liberty for being able to take the pharmacy project to the next level.
Well, there you have it. So there we go. This is Liberty Retail donating 250,000 Rand to Right to Care Health Services. Thank you very, very much. And that's, yeah, I imagine it's made your day.
It's wonderful, really. There's such a good vibe at Helen Joseph Hospital. They're phenomenal people here. Ian Zani, who's the CEO, he started this NGO in 2001. He had this vision. We're massive today, and Themba does wonderful work in health services, and there's just a tremendous commitment and passion to make a good contribution to healthcare in this country.
Excellent. Look who's joined us. The main boss of healthcare in the country.
we flattered you with some very nice remarks here.
Oh,
we're very proud of what you do for healthcare in this country.
Thanks a lot.
Thank you so much, everybody. I'm going to release you from this, and I'm going to have a nice conversation with the minister. We're all important in our own rights. Thank you very, very much. Now, Liberty giving money. Dr. Motsoaledi, Minister, isn't that what it's all about? I mean, we have to get the private sector involved.
Oh, yes, we are involving them at every available opportunity. Leanne, you might not know that I brought 16 private sector CEOs in 2010 and said we always debate and argue about whether this is good and this is bad and who is doing what. I said there are two things that can bring us together where there's going to be no argument, but the country will gain. I said it's the war against HIV and AIDS, and it's building human resources for the country. This week we're having a meeting showing the results of that cooperation, whereby 24 CEOs came together. They gave us a sum of 40 million Rand. And on Tuesday, we're awarding 24 scholarships for PhD from that amount, because we have agreed that we want to create 1,000 PhDs in the next 10 years. PhDs in the research in the field of TB and HIV. And that's a reality. Last week, we were giving those 24 scholarships. Last year, we gave 13. We are building up to that 1,000. The second amount, which is 10 million, we are using it to train the CEOs of our hospitals. You are aware that we are appointing new CEOs. They are trained from that amount. The third amount is to try and increase the number of medical students every year by 200 to augment what is being paid in the form of bursaries. So that cooperation with the private sector, we value it very much because we do things that benefit both the public and the private and the country as a whole.
Absolutely, and it's essential. And you see how successful it can be because, I mean, we're standing outside here, Themba Lethu Clinic, which is the biggest clinic when it comes to HIV treatment here in South Africa, and a highly successful one. When I've been talking to people and hearing some of the statistics coming out of it, I mean, this clinic for you, on a personal level, how do you feel about it?
Well, indeed, it's the biggest. It treats 10% of all HIV positive people in our country. If you calculate that there are 2.4 million people on treatment and 10% of them are treated here in this one clinic, you can imagine. I came here in 2010. I found people from as far as the Free State. What scared me at the dispensary, I found 600 people queuing there to receive their treatment. And now they've got a new method of dispensing, which has decreased the hours of dispensing from 5 hours to about 14 minutes. It's quite phenomenal. And they can see double the number of patients with the same number of staff because of all those innovations. But it's the most reliable clinic for HIV, and I regard it as the biggest in the country.
Certainly, and the automated pharmacy, I mean, I just think that the whole system here should be basically replicated in all clinics around the country. Is that the plan?
Of course, you pilot and see how things work. You don't just start by massifying, you know. But now once we realize that is working, I was still asking them about the cost and all that because we've got to look at all the other big centers. We're looking at many methods, Leanne, because let me tell you, and I'm not sure why some people don't notice this. From 2010, the number of people on ARV treatment has been increasing by about 500,000 per annum. In 2010, by February, there were only 923,000 people who were on ARVs. Today is 2.4 million. You can't keep on increasing people like that and believe nothing should change or nothing will happen. In the form of logistics and supply and all that, there will always be problems. So you keep on looking at innovative methods because look, this number of people who are on treatment will keep on increasing. Let me just give you statistics worldwide. There are 8 million people around the world on ARVs. 6 million are in Africa. And by 2015, the United Nations AIDS program wants to increase that number to 16 million people. That is double the number who are receiving ARVs. And the executive director was already worried whether pharmaceutical companies will cope, whether the supply chain will cope, whether the clinics and hospitals will cope. These are the things we are looking at locally, you know, in individual hospitals in the whole country, but also internationally, because we want to live in an AIDS-free world. And so we must come with all these form of innovations.
Minister, thank you for being with us and thank you for talking to us, especially ahead of World AIDS Day at what I think one can call a success story here in South Africa. Thanks for being our guest.
Thank you, thank you, thank you.
That was the Health Minister, Dr. Motsoaledi, talking to us here at the Helen Joseph Hospital outside the Themba Lethu Clinic about HIV and AIDS treatment in the country.